thank you everyone for joining to this open day event for our MSc in Health Economics and Decision Science. Just to let you know, this event is recorded and will be posted online on YouTube. So if you don't want to be featured in it, you can just not turn on your camera, or you could just ask the questions on the chat and we're happy to take it from there. So let's start. So first of all, why UCL? UCL is being at the front of disruptive thinking since 1826. It was the first in England that welcomed students of any religion or social background. Also the first to welcome women to university education. And the first to introduce new modules, new disciplines like English, German, chemistry, and engineering. It's been taking a brave and progressive approach that has continued until this day. And also recently has created the first fully open access university press. UCL is ranked at the top among the universities in the world. Currently in the latest QS ranking is number 8. So it's one among the top places to study. Yes, we pride ourselves on our academic excellence. We have 13 Nobel laureates that have been at some point at UCL. We have 11 academic faculties with about 43,000 students and 14,000 employees. We are #1 in UK for research strength. And this is also reflected by the vast diversity and variety of undergrad programs, nationalities that are represented in the student body, and of course the postgraduate programs that we are also here, that you are thinking of applying to. Our faculty is, as it is one among the 11 faculties in UCL, is the Faculty of Population Health Sciences. And within that, our institute, the Institute for Global Health, it's basically where this MSc is based. So what is global health? It's about health issues that transcend national boundaries and governments and call for actions on the global forces that determine the health of the people. And our approach to global health economics, which is basically the core group that is leading this MSc, it's about the collaboration across disciplines to find solutions to global health problems. And of course, we are aiming to provide the best possible teaching and research within this institute. We're spread across 3 places in London, as you can see in this bird's eye view. So there are 3 places currently that are part of IGH, of the Institute for Global Health. It's the Royal Free Hospital, a bit above the campus. And then within the campus, you can see there is the Mortimer Market Center, where some staff are based, and the Institute for Child Health in Guildford Street, where is the place where most of the staff that are teaching in this course are based. So we have about 35 undergrad students and about 250 postgraduate students. About 200 are MScs and about 50 are MPhils or PhDs. So more focused on research. So these are the research students. And we have about 150 staff. 120 about 220 are academic or teaching or research staff, and we have, of course, the helpful support of our admin team, which is about 30 members of staff. Here you can see some of the current global health economics projects that are run by colleagues in our institute. This includes projects like improving early childhood nutrition and development, prioritizing health interventions in low and middle income countries, protecting women from economic shocks to fight HIV in Africa, and point of care testing and treatment for STIs in pregnancy in Papua New Guinea. So what does this MSc in health economics and decision science has to offer? So you will learn how to understand consumer and provider behavior. So basically, you will see both aspects of consumers or patients and of healthcare providers. And of course, you will see how public policy can influence both of these aspects. You will also learn how to measure efficiency of a healthcare program, how to evaluate fiscal space for sustainable healthcare investments, and of course, to understand the links between health and various socioeconomic status or other characteristics, and what's the impact of this on equity. Now, in terms of the organization of this MSc, so it's basically around 8 modules. 5 of them are compulsory, so you will have to take the 5 core modules that we're gonna talk about in a bit about them. And in addition to that, you will have also to take 3 optional modules. So these 5 and 3 modules will give you about 120 credits. And with the dissertation, which accounts for 60 credits, so it's a very important aspect of this MSc, the dissertation, of course, you will get the 180 credits, which is the credits required for getting the award of the MSc. Most of our students are in full-time, so they take this over a period of 12 months. But of course, we also have students that are taking this as a part-time, so spreading it over 2 years. And also, you can also use it the flexible option, where you can take for a period more than 2 years. So you could spread the modules across 2 to 5 years to allow for more flexibility depending on your circumstances, or if you are employed or you don't have so much time to devote to this MSc. But yeah, the majority is on full time. And so to the core modules, that the 5 core modules that you have to take, it's basically the health systems in a global context, the statistics for health economics, the econometrics for health, the economic evaluation of healthcare, and the microeconomics for health. So basically, this core includes all the basic and important and necessary skills that you need to acquire in order to get the award and to proceed and move forward with your careers. Before the beginning of the term, of the first term, there's also a supplementary non-credit math and stats module that is being administered online. There will be an exam, but this is not going to count on your degree. And it's mostly basically to fill up some whatever gaps you may have through your undergrad studies, and to familiarize yourself a little bit with the context and the curriculum in terms of math and stats that are needed for this MSc. Of course, the one thing I need to mention is the microeconomics for health. It's on the second half of the first term. So for those who are not having an economics degree, they will have to take one more module. So from the 3 optionals, one optional module will have to be an introductory to microeconomics, which was offered in the first half of the first term. But this is only for students that are not having an economics degree. And so, as I said, depending on whether you need to take the introductory to micro or not, you will have a choice of 3 or 2 more modules to take, which are offered in the second term. So, and basically we have a big variety of modules. Some are short, so over a period of 1 or 2 weeks of very intensive and a lot of lectures happening almost every other day, where you could just get done with the module in a couple of weeks, or taking modules that are long, that are spread over the whole term, So basically, the whole idea of the optional modules in the second term is to fit your personal circumstances and your studies, also in combination of the preparation for the dissertation. Subjects, there are many subjects that are offered in this options list, apart from the introductory to micro that I mentioned earlier. Some are a bit more general, providing general skills like advanced health economics or advanced medical statistics. Other modules are more topical and focused on particular aspects and topics like urban health or climate change. So really there is a rich list of options that based on the choice that you're going to make is going to create a nice portfolio of modules that you have acquired during your studies. And of course, the skills that are it's more appropriate to your personal profile. And of course, the most exciting part towards the end of the year, which is the dissertation. This is needs to be some original, relevant, and critical work of yours. There are usually two options: either a literature review or a data analysis. Again, this is a choice usually of yours, so depending on what you prefer and on the topic that you choose to do. The idea is to basically apply the concepts and the methods you have learned over the first two terms over the course, to apply this to your dissertation. As I said, this is your work, so it's can be your choice of a topic. And then you're going to be allocated a member of staff that is more familiar to that topic. Or usually we have advertisements from members of staff that are proposing topics, and you can be in a discussion with that member of staff, so you can join the project. So your dissertation could be part of this. And of course, we have the internship option. So some students choose to do an internship, and sometimes they choose to use this as an option. And of course, the supervision will be someone from the institution that you are doing the internship, and also there will be an academic from UCL, so you will get all support that you might need through the internship. So the dissertation is really about managing yourself, so managing your time, your tasks, the relation with your supervisor, yeah, but more importantly, your time, because it's something entirely up to you, and the structure and how you want to focus throughout the months of the dissertation. So it's another important skill to get of how to manage, basically. Of course, during term 1 and term 2, there will be some mandatory workshops that are intended to help you and support you through the process of choosing a topic, proposing a topic, meeting with supervisor, and various other things that might help you in the process of the dissertation. Of course, in addition to that, we have other activities in the MSc. One of it is the masterclass seminars, where we usually once per term, so it's not heavy on your diary, but it's going to be once a term, where we usually invite someone, a leading expert on health economics or decision science, to present to our students some ongoing research. Topics usually in the past included the well-being and economic trade-offs of COVID-19, or topics on medicine pricing, or economic evaluation and evaluation of health systems. The support in that you're going to get in UCL, it's multifold. So you will get, for starting, you will be able to attend online pre-session language classes for those who feel that you would like to build your language skills. There's also academic writing classes that you will be able to take. Every student is assigned a personal tutor, which is a very important aspect of UCL, where that personal student, which is a member of staff, will be assigned to you, so will be able to advise you, support you through your studies. And it could be the first person of contact in case of you need some help for any reason related to your studies. Of course, we have the more centralized student well-being support and career services, both centralized but also within our institute that we are running with a big success over the last years. And of course, the MSc Heads team. And of course, you can find us more information online on the web. This is the website. Or you can just type in the search engine Health Economics and Decision Science MSc UCL. The email where you can ask queries about your application, or if you need any more information about the program. And of course, we are also on Twitter and on Facebook. Thank you very much for listening to this presentation. Now, the rest of the session, we're going to allocate it to answer some questions of yours, which you are free to either turn on your camera and ask the question, or put it on the chat. Happy to chat about it. And we also have a couple of alumni of our MSc, which are here to say a few words about their experiences, and we're going to welcome it in just in a minute. But just before we start, I would like to, probably from the beginning, I would like to introduce myself. I'm Stavros Poupakis. I'm the lecturer in economics in Institute of Global Health, and I'm the program director of this MSc. And I'm involved in the teaching of several modules in the MSc, mostly in the econometrics for health and the microeconomics for health. We also have Anna with us, the Deputy Program Director. If you want to just say hi, Anna.
Thanks, Stavros. Hi, I'm Anna Correa. I'm originally from Colombia. I'm a lecturer in health economics as well, and Deputy Director of the program. I teach in the microeconomics and econometrics modules, health systems as well. And I think that's it. So I don't know if we should take it. So we have two of our best students from last year today with us. We have Carmen and Yicheng. So they're going to tell us a little bit about their experience. So I don't know, Carmen, if you want to go first.
Sure, Anna. Well, I don't know how many of you are thinking or have decided about this master's, but what I can tell about my experience is that when I started, I had a specific idea about the master's because of what I have read and my own research. And I think as a good point for you to take your decision, I can tell you that my personal experience was very, very interesting, because I think it has been changing with the time somehow. When everything started, it was quite demanding for myself, because I'm not an economist. So I needed to take all these preparation modules to understand the entire context of economy. And it was a challenge for me, but at some point, everything started to make sense. And maybe at the beginning of the second module, is it trimester? I don't remember. Trimester, right? The terms, second term. So slowly, I started to feel that the program is built in a way that takes you from the very beginning and is going introducing you very, how can I say, like in a smooth way, because every activity that you will do counts for your preparation. What I mean is, for example, any kind of assignment that you will get asked to present or to do is building upon your next steps further in the master's. So from my perspective, it's a very clever program that brings the best of the field and in the recent trends, I would say also at the same time. So you don't really notice when you are already working in things that are already really relevant for the field. So once you finish, even though you will feel maybe exhausted because it's quite demanding, as Stavros mentioned, you will have the freedom to do your own dissertation And at that moment, you will recognize how much knowledge you have gained. And you will feel so confident because, and maybe even proud of yourself, because you realize how much knowledge you gain, how capable you are to be by yourself, conducting your own research. And of course, you will have a lot of people around you. I will say that masters in the UCL has a strength, very, very important strength is their team. Everybody around you, all the teachers, all the support staff that is around, all the module leads, everybody around is so friendly, so friendly and so helpful. So all of them are there for you, and they will bring you all the support that you will need. So once you finish your master's, you will find that you have achieved a lot. In my case, I did the master's in full time, so it was 1 year. So for me, 1 year of my life was very, very rewarding. And then later, once I started to work in my field, I realized also that all the knowledge that I gained during this year put me in the position to even have discussions with people and colleagues that have been in the field for years, you know. So I do believe the UCL Masters in Health Economics and Decision Science is great. It's being built in a very thoughtful way. So I cannot tell you more than I recommend you to apply and to do your best while you are there, and take the most of it if you can.
Thank you for those lovely words, Carmen. Can you tell us a little bit about what you're doing right now, by the way?
Sure. So after the master's, I decided that I didn't know if I would apply directly for a PhD position or not. So I started to research what can I do, either go to the market or what to do exactly. And I found a program that is from the National Institute of Health Research, and it is called the Predoctoral Fellowship. So basically, you will have a time to do some further studies and get some. So I applied for this predoctoral fellowship, but at the same time, you need to apply to perform this fellowship in an institution. So I applied in the University of Oxford in the Primary Healthcare Science Division, and I've been working with a team there. And yes, I'm trying to find my path exactly, because I think the doctorate position is a very viable one, very interesting one. And I think it's good to have this position now, because I can have the possibility to define with more time what topic I want to pursue for a PhD. So definitely, I can tell you, I just being in a conference, it's a study group from the UK in Manchester, was this January, and I was meeting so many people in the field, and all of them were so, for me, were amazing. And the most important thing for me is that every conference that I attend, I could understand most of it, if not all of it. So I was so happy, because definitely I was scared at some point, but I realized that I have all the tools, a lot of knowledge, and I don't know, I feel so happy for this, you know.
Oh, that's great to hear, and congratulations on your position.
Thank you.
Thank you so much, Carmen. Yicheng, would you like to go next?
Yeah, of course. Hello, everyone. My name is Yeking. I graduated from HAS last year, and currently I'm working as a teaching assistant and predoctoral researcher at UCL IGH. Yeah, basically it's the same place and work with same group. It's fantastic, and I assisted on part of the teaching, and also involved in the programs that are currently undergoing in the department. And my experience in HAB is more than good. And different from Carmen, I have a Bachelor of Economics, but I didn't find the course in modules, and my experience in is anything like repetitive or boring. I mean, health is a very interesting area, and the courses are designed quite good. You can, whether you have the basic knowledge of economics or not, you can always find you're learning new things, and you're immersed in a very dynamic environment. And also you can design your select-array modules to your interest. For me, I selected some modules with more advanced econometric or statistical techniques. It's interesting, and the techniques I learned are useful. And some of my friends, they chose like child health or urban health, and also climate change to investigate in these cross fields area. They talked like me the basic. They learned a lot of things from this field, and they are interesting and innovative. Research are going in this area. And also I want to emphasize, like Carmen, it's a really lovely and friendly family. Every person, every tutor, every module leader you meet is supportive, helpful, and they always give you support that you like. So if you are in this family, please never hesitate to seek for their help if you come across any questions, any challenges. They always give you guides. Yeah. Yeah, that I'm about to maybe hopefully start my PhD from September. I want to do to be in the academic area in the future. Yeah, but I have got a lot of friends from the HATS cohorts, and some of them went to the pharmaceutical companies, and even in the banking industry, a few of them, and some of them go to the consultancy, specifically in health economics. Because what we learn as a course is, I like to see very closely correlated to the works they have done as a consultancy, especially in the economic evaluation. You will find it's a very intensive, interesting, and useful module if you would like to join us. Yeah, that's pretty. Yeah, you are very welcome to join this community.
Thank you so much. Would you like to tell us a little bit about your experience with your dissertation?
That's an interesting story. I choose my dissertation topic based on my some of the experience in my undergraduate. So I didn't choose from the list. Before you study dissertation, you got to choose whether you want to work with some supervisors that are already on a project, or you can start a new topic from yourself. So I choose to investigate the impact of China's social housing insurance reform, their impacts on health outcomes and the health service utilizations. And luckily, I got a supervisor who specializes in the econometric method in this field. So I was guided and supervised to use a friendly new method called staggered difference. Yeah. Maybe you have heard of difference in differences method. It's basically developed from that method, and it's interesting. And I also found some interesting results from my dissertation. And based on my own research and the guidance, the supervising, then I received from my lecturers and my supervisors, my dissertation turned out very good. I think it's a good piece of work, and hopefully I got a chance to sharing with you what I have done specifically. And yeah, and based on my work, I got the chance to do this predoctoral fellowship in UCL.
Brilliant. Thank you so much. Right. Thank you very much, both Carmen and Yiqing. Love hearing your experiences. Right. Shall we move to if there's any questions? Either if you would like to unmute yourself or put in the chat. Right. So Tushar Roy asks, what proportion of students are typically able to undertake an industry placement in the summer? So there's not a set proportion, but for instance, this year we have two particular companies that are looking for interns. And it depends on the recruitment process, whether they'll appoint one or more interns. But it really depends on the demand every year that these companies have. So you would expect maybe a couple to have, and it will be a competitive process. So you will have to apply for this. I don't know, Stavros, if you want to add anything to this?
No, nothing. This basically said perfectly. The majority of students are doing a dissertation with us within the department. This is not like a business program that is typical to have the biggest chunk of students to do an internship or a placement. So yeah, but there is opportunities and there's competitive, and if you're interested, you can apply. But it's not that it's either guaranteed or that we expect students to do the internship. And we have one more question in the chat. There's a question about from Tara Pisakahi. That says that I've done the medical pharmacy. Does that count as a quantitative background? It really depends on the modules you have taken. So whenever we have an application, we are examining the transcript and the proposal and the cover letter and every other professional experience that the applicant might have. But in terms of the undergrad and the studies, it really depends on the modules that you have taken as part of your degree. Yeah, so if there are quantitative modules within that pharmacy degree, and I can show that there is the skills are already there, then that's fine. Of course, you can always put that in the cover letter to explain if it's not very clear. If there's no statistics or mathematics in the undergrad degree, it's going to be very difficult to attend this MSc. So it's the modules, and also the cover letter offers you the opportunity to explain whether some of the modules have these quantitative skills that we expect. Anna, anything to add from your side, maybe?
No, I agree. There's another question from Luke Flynn. Should there be, in the application, should there be more emphasis on previous academic or professional experience? I would say, both, really.
Okay. I think this connects to the previous point. If your undergrad was on, you had a bachelor on economics, and there there's all the transcript shows good grades and everything looks good, then it's not an expectation to have a professional experience. So in general, there is no professional experience expectation. But in a case of a degree that doesn't have the quantitative skills, then if an applicant had an undergrad that didn't cover all the quantitative skills we're expecting, but then there was a placement and that applicant has a couple of years of working experience that is been using quantitative skills, and then we can see and we can understand that this applicant will be able to cope with the demands of the program, then that would be good, something to show in your application. I hope this answers and helps. Anna, if you want, well, I'm sorry, I interrupted you, but it was connected to the previous one.
Yeah, no worries. Any other questions? So from Tara, just to clarify, does that mean I can still apply and get an offer, but may have to undertake additional modules during the first term? So what Stavros was saying is that, for instance, if you do not have, if your bachelor's didn't have sufficient quantitative modules, but you had sufficient professional experience to show that you do have those skills, then there is a chance, you know, if on balance it shows that you have the skills, you would get admitted. And then we have the maths and stats refresher at the beginning to kind of bring you up to speed. And if you do not have an economics degree, you have to take introductory microeconomics to also bring up your kind of some economic skills up to speed. So there are those kind of so Intro to Micro is compulsory if you do not have an economics undergrad, and the maths and stats refresher is compulsory for everybody. So hopefully everybody starts at kind of the same point. Stavros, I don't know if you want to add to.
No, nothing actually. As you said it perfectly.
What positions would you say one can secure with this degree in the context of pharmaceutical industry? So plenty of pharmaceutical companies are always looking for health economists, because whenever new products come into the market, you have to do cost effectiveness evaluations. And this is where your skill as a health economist comes in very, very handy, and it's very much in demand. Obviously, it's not just pharmaceutical industry. There's opportunities within policy, NGOs, various, you know, not just pharmaceutical, but other kind of health consultancies, and of course, academia.
Hi, can I ask a question?
Go for it.
Hi, my name's Annie. Thanks everyone for the presentation, and particularly the former students. Really great to hear like a lived experience. So my question is around kind of how technical is the course? So I've been working as a management consultant for a couple of years, and I've been doing kind of health evaluation and looking for a course really to kind of build up and make my modeling skills more robust. So I'm keen to learn a little bit more about that angle of the course.
Would you like to go first, Stavros?
Yeah. So, but what did you mention your undergrad? So, what was your undergrad?
My undergrad was in chemistry and molecular physics.
But you've been working as
a management consultant for the last couple of years, working in some pharma companies, but also doing kind of more public, more kind of public sector evaluation programs. So not specific to health, but within the public sector predominantly.
In that case, I think it's very important to make the case in the cover letter. So, if in the transcript that you're going to submit, there is no quantitative modules. By quantitative modules, we mean statistics, mathematics, or anything related to this that are linked to the program. But if you have built this, for example, if you have done cost-benefit analysis or anything like that as part of your consultancy, then something definitely that you will need to include your cover letter, of course, your CV. You will also submit your CV. So the thing is that it's not that there is a one thing that we expect to see, and if it's either this or not. It's the admissions tutors are looking at the whole candidate profile. So, but then it's very important if it's not obvious from the transcript, from the degrees, it's very important to showcase this in your cover letter and your CV.
And regarding your question about how technical the course is, so it depends what kind of skills you're trying to build. So for instance, two of the core modules, econometrics and economic evaluation of in healthcare. So econometrics is very hands-on. You're working with data sets, working through code, data code. And that's usually to kind of evaluate, does this particular thing have an effect on this particular outcome? Then you have economic evaluation, which again is very hands-on as well, with real examples, real world examples. And you're trying to calculate cost effectiveness. And if you take one of the optional courses, modeling for decision science, as well, that is very technical, uses, if I'm not mistaken, MATLAB, and you'll be working through code to kind of model the spread of a disease or an infectious disease and so on. So yeah, and obviously there's other modules that will be, so we are very using real life data sets, anonymized, obviously, and scrambled and so on. You work through code, so it'd be very, very practical skills.
Fantastic, thanks both.
Okay. Not sure if this is relevant, but how would you say this course is different from international health policy? That is I can't say because I don't know what they teach. Sorry about that.
Until maybe someone's still thinking about asking a question, there's another question I thought about that usually has been asked is about the research proposal that you will also require to submit your application. So first of all, this is not the case that you are asked to submit a research proposal, but you will be able to change it through the course. So it's not that you have to do this as your dissertation. So although we require everybody to submit a research proposal, it's not mandatory that you will continue and to proceed this research question. Now for the research proposal, what we usually advise is that it needs to show some motivation about the research that is proposed. It needs to have clear research questions and research objectives, and of course to discuss a bit about the methods and the data that the applicant would like to use in order to answer this research question. We usually advise applicants to look at abstracts from published articles, from published peer review articles, to get an idea of how this usually should be. Yeah, so, and again, this also relates to everything else, that again, this is going to be evaluated during the admissions, and it's another component or part of your application that is going to be assessed by the admission tutor, whether we'll admit you or not in this program. So it's very important. It's not that it doesn't oblige you to continue doing that, but it's a very important aspect of your application. Okay, I think we're just on time. Yes, it's we should be wrapping up about now. If there's any last question that anybody would like to ask, if not, you can always, as I said in the presentation, there is the website and an email that you will be able to send inquiries if you like to before applying, if you would like more information about this. But yeah, if there's no more questions, thank you very much for joining in, and thank you very much to our two brilliant alumni students that shared their experiences with us, and for also congrats again for their management placements to both of you. And yeah, and I think we can close here. Thank you very much, everybody, for attending.